Hi everyone, this is Adrienne with Good Dental Media Insider Series, and I am joined today by Dr. Mark Thoreson. He's a dentist, an educator, sales leader, product innovator, and has a unique perspective in the dental industry. He's owned general dental practice in the Pacific Northwest. He's expanded his career in dental education, laser dentistry, product development. He's had leadership roles with Fotana and Denmat, decades of experience across the clinical dentistry, business, and technology. And his most recent project has been developing Inflatrix, which has been a fun product that I've seen in the market as of late. And I'm so excited for you to join me to talk more about it because I do think that the word should be out for multiple reasons. And one of them being, my own experience in the dental chair, and also witnessing my children go through this experience as well. So I want to thank you for joining us, Mark,
You're welcome.
and we're going to dig in a little bit to what Infotrix is about. Um, so if you want to maybe just give me
Mhm.
like a 1 minute kind of rundown of what your product is in this market.
Well, I'm very happy to do that. Thank you for inviting me, Adrian. Uh, Inflatrix is a response to the classical format and century-old concept of the Toffel-Meyer matrix band system. As a young practitioner, clinician, and idealist wanting to save the world a tooth at a time, I was frustrated with the method, the number of pieces, the amount of time required. My elevator pitch says that the current system uses too many pieces, takes too much time, and too many patients are sore post-operatively, even several days. Uh, and there had to be a better way. And got the flash when I was watching a James Bond movie years ago. And make a could be a very long story short.
Mhm.
There's a huge airbag that explodes inside a telephone booth as a James Bond gadget. And I threw up my remote and ran out of the room. And the next hour or so, I had first drawing of Inflatrix because the concept came together at that moment. It's entirely doable, and we've proven it now. We have MVP that a dental matrix can be a single piece. It can be inflated with air and water pressure and hold itself in place. Need no wedge, need force, no sudden acute orthodontic forces on the PDL fibers for those clinicians out there, uh, which is what makes it sore afterwards. But it also makes the process much faster and much simpler. It's single use, throw it away when you're finished. Uh, and we have MVP. We have tons of social proof. We have KOLs who are, I have inbound clinical feedback from both pediatric and GP key opinion leaders, but also rank and file doctors in my neighborhood and across the country who have validated my claims. It is simpler, it is faster, and it is much more comfortable
So
than
this
me.
is this is the metal piece that's used to basically separate the molars or separate teeth so that you can focus on one tooth while you, I mean, I'm putting it in layman terms.
Yeah.
This the metal piece that goes in between the teeth so that you can focus on doing work on the one tooth and the other tooth being protected, correct?
Well, yeah, the correction I must make is that the usual system is a stainless steel band that's shaped
The
a
band.
specific way.
Yes.
With Inflatrix, we take away all the band, all the wedge, all the clamp, and we have one piece that attaches
Band
to it.
clamp being metal in between, shoved
Right.
in between a
Yes.
tooth
Yes.
sounds horrible. It sounds like a giant piece of metal steak that's just stuck in there, and I will say I've experienced this firsthand just recently at the pediatric dentist. Both my children had
Hmm.
to get fillings,
Yes.
and their GP or their pediatric dentist went to use this product, and in two different instances, they weren't together, separate rooms. Both of them 100% denied the product once it was put in. They were like, no, 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 no. What is that? Take it out, take it out. This is
Right.
not happening. They were freaking out. And it was like a light bulb moment for me because I've seen you in the circuit, in the startup circuit, presenting this product. And it was
Wonderful.
a light bulb moment where I was like, oh my God, this is the perfect opportunity
Yeah.
to use a product like Mark's instead. That probably would have been a much easier transition, and easier for the dentist and for the patient.
Certainly.
Yeah.
And with the outcomes that we're pursuing, and especially in the laser dental world, and as you're probably aware, I don't remember if you said your pediatric doctor is a laser dentist, but most pediatric dentists, carefully stated, correctly stated, are laser users.
Hmm.
And that means that 90% of the time, they don't give shots for that. And the anesthetic that is generally required for comfort with said band and wedge
Hmm.
has to
Hmm.
be adapted. They have to add it separately, even without giving the proverbial shot, because they still have to stick a band in there. They still have to shove a wedge in there.
Yeah.
And Inflatrix removes all of that requirement.
So
So,
we're talking a 30 year or however many year you were saying. I remember one of your pitches you were saying that this procedure, this platform of using the metal bands
mhm.
has been happening since you were a child.
Yeah, yeah. The
And
Toffelmeyer
it still
concept,
exists now.
the
And nothing's
Toffelmeyer concept has been around for 100 years. And in 1971, I had my first filling at age 8, and that was the technique that the dentist used then. When I finished dental school in 1991, it is the same technique that I was taught. And in today's graduating class in May and June of 2026, that is what they know. I say that the old systems, old meaning the one's current status quo, yes, they work, but so does a 48 Plymouth. You can still get from point A to point B, provided you know how to drive a 48 Plymouth. Well, in dental school, that's all they've taught us is a 48 Plymouth.
okay. So tell me the benefit that doctors and patients are seeing when Inflatrix is incorporated into treatment.
The procedure can be the scheduled uh, time slot for a scheduled class 2 restoration can decrease by 20 minutes.
Okay.
And if it's a laser process, it can go shorter still. But the placement of the device requires far less than 30 seconds. The current status of the usual Toffelmeyer is between 60 and 75 seconds, even for doctors who have done this tens of thousands of times and have an assistant handy. Inflatrix goes in place much faster. It inflates, and but my demo video is very clear on that. I don't need to take a bunch of time here, but it does hold itself in place. There's no extra effort required, and the doctor can start the restoration placement much faster. Um, we make no claims or suggestions that the placement of said composite resin somehow is quicker, because we can't say that, but we can say that the result is overall saves time. It's one piece to be done with and ordered and then thrown away. And then when they follow up and ask the patient 2 days later, which is what we ask for, uh, are the patients as sore as they were when they may have had the previous Toffelmeyer method? And the
Mhm.
answer by far is that no, they're not.
So
Okay, so
this is a plastic piece, right? And what are you filling it with? Air?
it is
Water?
both, actually.
Both. Okay.
The device is made of a polyurethane sandwich. One
Okay.
side is very, very smooth and thin, especially in the contact area between the bubbles. When people go, doctors go and look at this online.
Hmm.
Uh, get in touch. I'll send you a sample for beta testing. But one side is smooth that goes up against the cut prep. If at all possible, a very ideally shaped. So far, we make no claims that Inflatrix answers everything. Okay, that would be crazy. But in ideally shaped, there's a smooth side and then a formed side with the bubbles in it, and those are attached together. And
Hmm.
then there's a fill tube that attaches to a 3 to 5 milliliter Luer syringe that has tap water in it.
Okay.
Okay. Well, you heard me say both air and water because I can't claim that we're pre-filling the device with only water. And we have found in our beta testing to the MVP stage that a combination of air and water makes a very solid, very reliable pressure. The balloons in the device go to 3 times their usual size, holds itself in place. A little clamp goes across the fill tube. Go to work.
Okay. And then when you're done, what do you do?
And when you're done, you've created the proximal contact. Deflate. You can either use the syringe to pull out the water and air you put in, or just disconnect it and release the valve. And the little couple of drips, it's not this, very small amount of water, that falls on the patient napkin. And then you floss the device out, wiggle it out, throw it away.
Amazing. Okay. So looking ahead, where do you see Inflatrix and this innovation, and where do you see it going in the next few years? What's your vision for this product?
We're starting with posterior restorative, and we will probably morph into an anterior version of the device. We'll be making three sizes plus left and right-handed versions, so six individual items, because we have to be able to put the device between molars and premolars and between primary teeth.
Hmm.
So three sizes times both sides. And that's our start. And as we're on our way to traction, then I have four additional more versions of this technology. We have two patents and a trademark, and everything is awesome. FDA says 510(k) exempt. Fabulous. Well, we're going to go for there's an orthodontic application, there's an oral surgery application, and another isolation type application. Those are in early stages, but we need to prove, we don't want to ask the dental public to buy five products. We want to prove one and then build on the name.
Okay.
Mhm.
So if a doctor is interested in implementing this, say it's a pediatric dentist or a dentist that, maybe works with people that have sensitivity to these things, immediately my mind goes to patients that may have special needs, that are very sensitive to things like that. What could they do to reach you currently to try this product in their practice?
Well, inflatrix.com, as it's spelled behind me.
Okay. They can fill out a
That's our hub
form.
at the moment. You can reach out on LinkedIn, a wonderful page there. Um, doctors can come to one of Travis Rogers' Dental Venture Capital pitch events monthly. Those are fairly easy to find.
Yep.
But my email is drmark@inflatrix.com. Reach out.
Okay.
I'm happy to do that. I have I have some final MVP beta test units available. I don't have a lot, but because doctors want them. But
Yeah.
no, I'd love to be in touch. Thank you, Adrienne, for helping me spread the word.
Thank you so much. This product sounds amazing. Can't wait to see it grow and get more out there in the market. And anybody listening to this that like to help with that, Mark is all ears, and we're happy to have you in this community. Thank you so much.
Thank you very much, Adrienne. Appreciate talking to you today.
Thanks.